Does the thought of seeing a gynecologist and possibly having a pelvic exam give you so much anxiety and stress that you would rather not go? I'm Dr. Jessica Reinick. I'm a double board certified OBGYN and reproductive endocrinology and infertility specialist. I'm going to give you some tips on how you might make this exam a little bit less uncomfortable. My first tip is that you should definitely try to make sure you find a provider that you can trust. You definitely want a compassionate, caring, knowledgeable, and professional provider to do these exams for you, and that might mean meeting with a few different doctors before actually getting to an exam, because you really want to make sure that you're comfortable with the person that's doing these exams, because that will make it more comfortable for you to actually do them. If possible, I would recommend trying to set up some sort of visit before actually setting up an exam, because then you can talk to them, they can explain the process to you, you can ask questions, and all of these things can help you to feel more comfortable when the actual exam is ready to happen. On the day that you're going to have the exam, I would suggest asking if you can have a support person there with you, either a family member or a friend that can either just support you with their presence or advocate for you in ways that you might feel you can't advocate for yourself. You also want to make sure that your provider knows about your fears. You can just say, pelvic exams are hard for me, and that will help them approach it in a better way for you. Know that you are 100% the person that is in control of these exams. Even if it feels like by our recommendations and our advice, like this is an exam that's really important, if it's not the right time for you, we do not have to do it. Even if you give consent, you can withdraw that at any time, and that includes once we've even started. If you do proceed with the exam, you definitely want to make sure you're in the right position, because that can help make sure that the muscles can be maximally relaxed. So you want to be all the way down at the end of the table, and you want to try to just let your knees kind of fall out to the side in a relaxed position. Obviously, that doesn't really make sense. How can you be relaxed in that kind of position? But the more that you're able to let those muscles in your bottom kind of just drop into the table, the less uncomfortable these exams will be. You can also practice deep breathing. That can help relax the muscles even further. In terms of the speculum, you can ask for the smallest speculum available. You can ask for gel if it's not going to disrupt whatever kind of exam that they're going to do, and you can ask for warm water so that the speculum is not cold. I also support whatever distractions you might think you benefit from: music, podcasts, watching something on your phone, TikTok, whatever you want. The doc or provider likely will be trying to walk you through the process, but totally fine if you just want to zone out. Finally, if you've had a really hard time in the past, or if it's your first exam, or you're just feeling really anxious and stressed, you can always talk to your provider about anxiety medications that might be beneficial for you prior to the exam. I hope this is helpful. If you've tried these things and you're getting pushback or feel like you are being kind of negatively responded to, definitely consider reaching out to a new provider. There are wonderful, compassionate, trauma-informed providers who can provide you with comfort during this uncomfortable process. But these are some good tips, I think, to start with.